going to show a technique to help release the quadratus lumborum, the QL of the lower back. Many ways to do this technique. You can do it prone, side lying, supine, standing, sitting, off the table, etc. But we're going to show you a great way to release this muscle in this position. So I'm going to be working on this side, Kiki's right side. So what I like to do, I like to position a client, if possible, in this sort of like bow shape. So I'm going to bring this leg across as much as possible and cross this leg over the top and bring her across to her range of motion. As long as she's covered in that position. Comfortable? So what I like to see is the hip drop and this space open this way. One thing you need to be cognizant of is there's no pain on the left side. So if they're getting some pinching or impingement on this side, this technique might not be a great setup for you. Kiki's got pretty good range of motion in her hips, so we can really open up this side of the body. We can also drop this arm down and or even better across. So reach her like down and across there, Kiki. So it just puts a bit of extra stretch on the QL. So a few basic strokes first. I like to pin the left side hip first because I want to just apply some very broad myofascial strokes to the lower back this way. So I'm not really applying a lot of pressure here. I'm just stopping Kiki's body doing this. So I can use a fist, I use my palm. So these are just superficial strokes just to get the area ready for deeper pressure, more specific work. Feels okay? You can even apply more of a traction force here and come across. Different anchor spots on the opposite side of the body will feel different. So we're always trying to create space in the joints or the surfaces we're working. So I'm trying to create some space in this lower back. So just very broad brush technique strokes now. Using the blade coming across. So when you're working the QL, after you've done your broad brushed release technique strokes, just relaxing the whole area, the couple of key spots you want to focus on. Iliac crest. So you find trochanter, work your way up, iliac crest is here, and I trace it across. So this is Kiki's ilium, this area. So I want to basically scrape or release across the bone. So my middle finger is contacting Kiki's iliac crest, so we know the QL inserts there. So now we're being very specific with our work. So I follow the ilium. Extended fingers, relaxed, arm is straight. Always applying this pressure here to stop broad rotation of the hip. And I just follow the bone, that landmark across. So this is going to be the lower part of the QL. I can use knuckles, so I just follow the crest. So get used to palpating the bone And it's actually way higher than most people think. People think the iliac crest is down here. It's actually way higher, look. This is the ilium. Then there's not a lot of space in between the crest of the ilium and the 12th rib. So to palpate the 12th rib, you find the crest, there's a soft spot there. If you keep moving up, this is the rib. This is the 11th and 12th rib. Iliac crest, soft spot. Keep moving up, you're going to bounce into that rib. The QL inserts or originates from the 11th and 12th rib. So now we want to do the similar stroke, but now we want to work across the ribs. So the ribs angle downwards. So iliac crest, rib. So I'm going to come across and I'm hooking the rib and I'm working, so I'm tracing the rib. Be careful here with floating ribs, you're not applying a crazy amount of pressure, but you're just trying to affect that area. Yeah. Follow the rib down. And it angles down slightly. The lower ribs don't have as much of a steeper angle as the upper ribs, but they do definitely have a downward rotation to them. So see, now we're trying to create this space, rib, crest, we're trying to open that. So once you address the pelvic portion of the QL and the rib, I like to come in between those two landmarks and I start on the spinous process and I slide over the erectors and you're going to fall off them. So the erectors, lift your head, Kiki. Actually, let me straighten your legs real quick. So lift this leg a little bit. Lift this leg. So you see the erectors pop up here and then she relaxes. Good. These are my landmarks. So a 45 downward pressure. So this is erector work. I slide off the erectors. Then I hook my fingers and I pull back this way. So now we're going to try and affect the mid part of the QL. The QL has 3 distinct raphe that go in multiple directions. Hence why it's very hard to stretch the QL in these multiple stretches. 45 degrees. As soon as I slide off the mound of the QL, I hook. I step back and pull this way. We get a lot of like ligamentous tissue here as well. Feels okay? I'll get right when Kiki goes too quiet. Slide down, 45. Slide off the mass of the lumbar erector, sorry, and I hook and I pull. So when I'm hooking, I'm like this. I'm hooking and pulling. Hooking and pulling. Another great way to work the QL is in a seated position. Iliac crest. Apply a nice soft elbow. And I'm just going to literally be on top of the ilium. And my pressure is downwards this way. And just slide across. So of course we're hitting some gluteals here. Some fascial tissue. But the intent is a quadratus. So my pressure is not purely down, it's down and to my feet. I'm always turning my arm. So if I find a sore spot, instead of moving my arm to work through that, I just turn here, or I make a fist and activate my arm instead of moving my body. So here I'm turning. So when you're working the QL, you can put them in different positions. So if I bring Kiki's leg across, it opens up the space. If I bring the leg across towards the camera, it shortens the space. So play with the angles. Key thing is to work the landmarks, the bony landmarks. Trace the ilium, trace the ribs, lower ribs that is. Use the lumbar erectors as your guide here and try and hook and come underneath. And this is a great way to really get some relief to the quadratus. Most people come to us with lower back pain. When they say my back hurts, they normally put their hand right about here. And this is QL sacroiliac area. So this is always, not always, it's generally involved in lower back hip pain. Most of our clients who have lower back hip pain, you will generally find some exquisite tenderness and or trigger points or shortness in the quadratus lumborum.